Okay, brilliant. Okay, well, thank you very much, everybody, and welcome to this week's webinar from the Independent Scientific Advocacy Group. This week, we're talking about COVID elimination strategy in Europe and its implications for Ireland. And we've got a very distinguished lineup of speakers to bring some different European perspectives to you today. But as usual, we're going to quickly start with a situation update in Ireland, the cases in Ireland, and this is going to be brought to you by James Merrick. Thank you, James.
Thank you, Aoife. I'll just bring up the couple of slides. So do you agree with Corrigan? So we'll start this week again with Northern Ireland, and thankfully we're seeing a continuation largely of a good trend and the effect of vaccination. So the blue line here is the over 80 group, and the red line is, say, the over 60 to 79 group. And these groups would have been vaccinated early. And I want to point out that this is a logarithmic scale on the y-axis. So broadly a continuation of the trend we talked about last week, with case numbers going in a good direction, with this distinction in the underage group, the children, which we will see, we'll discuss a little bit more in the context of the Republic. So, excuse me. Yeah, it's great. So the to the Republic, just a distinction between healthcare workers and non-healthcare workers. So again, with the logarithmic scale on the y-axis, we see that this is the blue line is a line of healthcare work cases amongst healthcare workers, and we're seeing the benefits of vaccination. But one point to make with this chart and the previous chart is that we're 3 months into the year. Vaccination in these groups in Northern Ireland and the Republic started early in the year, but it takes a long time. It does take time. It's not an overnight solution. Vaccination. In the non-healthcare workers, we're seeing this broad rise. One development, this is broken out by, now the colors in this line are all two distinctive age groups. Blue line 55 to 64, orange line 65 plus. One difference from last week is that we see this uptick in the blue line. So it's probably too early to say too much about it, but it would be consistent with cases rising in younger age groups and spreading through other age groups throughout society. We'll keep an eye on that. For the younger age groups, it's the continuation of the same issue that we discussed last week, highlighted last week, about the rising cases in young people, particularly children, particularly after schools reopening. And we pointed out before about particularly the lack of measures in schools in the presence of B117 and airborne transmission, and the lack of screening testing. And this is again a logarithm. So we're seeing this rise on the exponential growth, essentially, with this these increasing lines on an exponential axis. So that's just a continuation of this worrying trend that was pointed out last week. On a positive side, just a quick breakout of there are quite different regional stories around Ireland. So the blue line here is Cork and Kerry, and we see in this case, the orange and yellow line. The orange line is Dublin, for example. So in the last few weeks, progress in reducing case numbers has stalled in Dublin, and we see this increase coming back into play again. But Cork and Kerry, the decrease has been maintained. And this number's on the right hand side, but if Cork and Kerry was at the same sort of daily case load back in early January, if the whole country the whole Republic had followed the same trajectory, the kind of national caseload would be 120 as opposed to the 500 and 600 we're seeing. And so we hope someone is doing the work to learn the lessons from Cork and Kerry that can be applied elsewhere. And then final slide before we get into our discussion, just given the nature of our discussion, just wanted to show just a quick chart on the international situation and Ireland and Northern Ireland as part of the United Kingdom, and the place here. While in the United States, United Kingdom, we're maybe seeing some leveling off. This is cumulative confirmed COVID-19 deaths per million people over the course of the pandemic. Ireland, the European Union, we see this increase. Brazil, there's a sharper increase ongoing. Some countries at high levels are leveling off. Within the European Union, there's this broad distinction. Hungary is up here, and Cyprus and Finland are down here. Ireland is here. So there's a divergence within the European Union, this overall increase. And then, of course, we see South Korea and New Zealand and everybody else down here, where restrictions were less, and in terms of domestic life and deaths have been less. So that's just to give us some international European context before our conversation. So thank you all.
Thank you, James. That's very useful as always to get an update on what's happening. So I'm going to move now to the first of our speakers. I'm going to call on Cecile Philippe, who is the president of the Institut Économique Molinari, and she is an economist, and she's going to give us her own personal view and a view from France. Thank you, Cecile.
Thank you very much for inviting me and to share a few thoughts about the French strategy concerning COVID. I don't know how much you know about France, but actually France has been following a mitigation strategy since the beginning. And after a strict lockdown back in March of 2020, then we experimented with a series of, I would say, quite strong measures, of course, wearing masks, but also the total closure of cafes, restaurants, and any kind of performance venues. And they had to add a few new measures in the recent time with localized lockdown, like during the weekends, etc. And right now, because the number of cases is exploding, we are waiting for new announcements concerning new measure. The one thing that is maybe peculiar about France is that schools have not been closed since the first lockdown. The number of contaminated kids is increasing very fastly. So the main thing that is being discussed right now is, of course, should we close again schools? And it is a tricky issue because the closure of school is also assimilated to the end of schooling, which is so meaning that it is not really well communicated that actually it could be a distance learning. So as far as the institute is concerned, we've discovered the zero COVID strategy. Some months ago. It is not discussed really in the public debate. Some people, some voices have raised the issue, like Antoine, for instance, maybe not exactly zero COVID, but at least very, very strict suppression. President Macron mentioning last October, and our French scientific committee also mentioned that it would be a goal to try to reach less than 5,000 daily cases. We never reached that level, and the goal was simply completely forgotten. So at the institute, because I guess it's a European story that we have thought from the beginning that there is a compromise to be made between health and economics, and we are economists. We decided to look at the numbers that are now available, like the OECD publish the number of GDP growth, and there are a lot of mobility data available through Google, etc. So we decided to look into the data, and we are in the process right now, as we speak, we are in the process of publishing our report on the economics advantages of the zero strategy. So I'm going to share a few slides with you and comment them with some of the results we reach through this study. So I'm going to try to show you this. Yes, here it is. Can you see it? Can you see the?
Yes, we can.
Yes.
You can put it on diaporama.
Yeah, that's what I'm trying. No, that's not the right one. Here. Yes, it's working. Okay. So here you can see the mortality associated with COVID-19 by major regions, and we can see that actually the impact has not been. The impact has been really high in North America, South America, and Europe, and not as high in Asia, Africa, and Oceania. And actually, there are reasons for that. In this slide, you can see that we've done analysis of the relative performances of the 11 G10 countries, and it shows that 3 countries like United States, Switzerland, and Sweden, accounting for 43% of the population of the G10 countries, have protected their economies more than their people. 4 countries accounting for 25% of the population, they are Belgium, Italy, United Kingdom, and France. They actually done the contrary. And they have been doing worse on the economics and for the people. 3 other countries, Germany, the Netherlands, and Japan, 48% of the G10 population, did so far a better job of protecting the people and their economies. But finally, if we broaden the analysis to include the OECD countries applying the zero COVID strategy, we see that actually they've been able to defend both their economy and their population, and they have very much lower mortality and smaller declines in GDP. So, focusing on the zero COVID advantages versus other strategies, you can see that they have short-term positive effects. Those countries pursuing a zero COVID strategy have had a less severe economic decline in the second quarter of 2020, with minus 4.5% and minus 11.7% for the other countries that have been that have saturated their healthcare system. And actually, it also shows, I could not share all the graphs, but what is really interesting is that the zero strategy has lasting positive effects. In the fourth quarter of 2020, the countries applying this strategy had almost returned to normal economic activity. Their GDP was down only slightly, minus 1.2% compared to 2019. And the decline in GDP was much greater in the other countries, minus 3.3%. And actually, it's only on the 2020 numbers that were available. When you look into the Google data mobility, you can see that workplace traffic in the second quarter of 2020 fell by less in the countries applying the zero COVID strategy, minus 14% compared to 36% decline in other parts. And it also shows that actually the zero COVID country retained this significant advantage with a 15% reduction in mobility in January, February 2021. On this slide, you can see exactly the same thing for leisure and retail. Then we did a focus on restaurants, because France is a touristic country, and we are supposed to be very proud of our food. And actually, restaurants have been closed for almost 6 months, and we plan on having them closed until September. And again, and actually New Zealand is an interesting case, because they also have a very dynamic touristic sector. And it was interesting to see that Google data show that searches for the word restaurant were 64% lower than in February 2019. And the decline was 5 times, that's for France, sorry. And it was 5 times greater than what was going on in the zero COVID countries, where restaurants are open and searches are down only 13% from February 2019. So I'm going to stop that. Oh, and back. So actually, our conclusion from all this data is that, of course, the advantage of the zero COVID strategy in terms of health is really clear, and it's immediate, and it is less clear to see the economic impact of the COVID strategy, the zero COVID strategy, especially because actually it's an investment at first, and there is this whole dynamic about the impact of eliminating the virus. So that's why we thought it was important to have those numbers to see that actually there was no compromise to be made about saving lives and saving the economy. And so our main recommendation right now in France, while we are waiting for new announcements from our president, is really to start a dialogue, an open dialogue with those countries that have been able to implement this strategy. And actually, as Antoine Flahault once pointed out to me, is that actually we have a small French part that has been able to do this strategy, New Caledonia, and that actually we could also try to speak with them and see how they do it. But that's where we are. Sometimes we feel a bit depressed about the way things are going very fastly in the wrong direction. But hopefully it's going to bring some new data that are going to be discussed, and maybe we'll give it a try.
Thank you, Cecile. That's very useful, very engaging presentation, and I think very interesting to hear you describe the zero COVID strategy as actually an investment in the economy. It's very interesting to hear it put that way. So our next speaker then is Professor Antoine Flahault, who you just heard mentioned briefly there by Cecile as well. And Antoine has both a medical degree and a PhD in biomathematics, and he's Professor of Public Health and Faculty of Medicine in the University of Geneva, and he's also the Director of the Institute of Global Health. And so it's a great pleasure to have you here today, Antoine, and I look forward to your contribution.
Thank you very much for this kind introduction, and congratulations for this initiative. Yes, I really think that we have lost an opportunity of going towards a zero COVID strategy, or at least a suppression strategy, because we could have a discussion about the advantage of suppression strategy aiming to a goal of no COVID or a zero COVID strategy. But we lost at a European level, also the Canadian, this opportunity. I'm not mentioning the USA because I'm talking about last June. Last June, Canada and all Europe was in a very low circulation, probably close to the level Portugal has reached today. And Portugal is probably the only country in Europe which has reached such a low level of incidence of new contaminations, and also of very low mortality rates. But Henrique will talk about that just after me. And Ireland is also among the new champions in Europe, with the UK and probably the Denmark too. So you have in these countries I just quoted, you have another opportunity to embrace a zero COVID strategy. In Switzerland, we are not at this stage. We are very similar as Germany, I would say, maybe lower than France as a level of the plateau, but it's no more a plateau now. It's going up again. A new wave, the third wave, we are experiencing in Switzerland, particularly in the German-speaking part of Switzerland, but Geneva, which is in the French part of Switzerland, is following also the same trend, which is worrying and which seems not to be controllable with the partial lockdown measures which are implemented and which probably will need, as we can see in France currently, some reinforcement in the coming months. But the good news, if I can say that, of this third wave is that, as any wave, it may go down. It may go to a very low level in a couple of weeks or months after these first investments Cecile was talking about, which may be a strict lockdown with school closure for a couple of weeks, which will end to hopefully a very low level of circulation. And so I think it's very timely to talk about this issue now, because the objective of this repeated lockdown is to stop the repetition and to have something which may be much closer to what happens in New Caledonia in France or in Asia and Pacific. I'm not sure that our people in Europe are ready for a zero COVID strategy, but I am completely sure that it is achievable to at least implement a suppression, an aggressive suppression strategy, which is roughly similar because it imposed some border control, strict border control, which probably will be very difficult to maintain in Portugal, but maybe Henrique will comment on that. And it seems to be needed to be implemented at a continent level. Of course, it will be easier, or it may be a bit easier in Ireland or in the UK, although I think there are some worrying signals in Ireland you mentioned at the beginning of this talk. So it's very urgent if we want to implement a suppression or zero COVID strategy to see how we will implement an effective border control, how we will implement an effective contact tracing, I mean a backward contact tracing, how we will implement an effective isolation of people and an effective and massive use of digital traces. I think these are the pillars of the strategy we are promoting, and it needs some thinking, some agreement from the population, sometimes some modification of the regulation. Over from me.
Thank you very much, Antoine. That's very, very interesting. And it's interesting to see how you look at Ireland from the outside and you see that we're in this good position where we could potentially go for more because we're feeling pretty glum about our numbers. So it's interesting to see it from another perspective. And yes, it would be great if we went in for the final push. And you mentioned Portugal there, which is a perfect lead into our third speaker, Henrique Barros, who is in Portugal, and he's the president of the National Health Council there. He's a professor in the Faculty of Medicine and president of the Institute of Public Health at the University of Porto and president of the International Epidemiology Association. And he's responsible for the design and implementation of the 3 Portuguese population-based cohorts, which are examining the population there. So Henrique, it's a great honor and privilege to have you here to give your perspective today.
Thank you very much. I will, if you allow me, I will share just a few images, so for you to have an idea of the situation in from where I'm talking about. You can see here, this is the dynamics of the epidemic in Portugal. I just pick up the 2 major regions of the country, the Lisbon area and the north of Portugal. They represent more than 2/3 of the national population and most of the cases in the country. And as you can see here, we had it seems like 2 epidemics separated by less than 200 kilometers, which is one of the puzzling things for us to provide a clear and coherent message to the population. As you can see here, Portugal never had a zero or elimination official approach. I can use Antoine's words. We had a really aggressive suppressive strategy because we went into a very tough lockdown even before the first deaths occurred in the country. And as you can see here, in March and April, then we had this ongoing kind of slowly kept cases in the Lisbon area. And then we had these two distinct waves in the north and one clear and the highest wave in the south. So I am showing this because if we feel that all the effort, because we are one of the countries that have spent more time with restrictive measures, all this effort that clearly has an impact in the economic situation and in the social situation and in mental health, this effort in a small country like Portugal, and this was a national effort. We had not that much regional responses, although you can look at islands, the archipelago of Madeira and the Azores, as the areas where there was less, the lower number of cases, and where an elimination strategy is easier to imagine. But as I am telling, my first point is this one, to have a good way to communicate the idea that all this effort need to be effective, and we can expect something really good from all the effort we have. The second image I would like to show you is looking at the north of Portugal and at our university hospital, where more than 5,000 health workers have been vaccinated by the end of last year. You can see here, just looking at the data, how effective vaccination is, and this is a nice argument in favor of trying to clearly opt for a socially accepted elimination strategy, because now we have a tool that might be essential for that and will make all the efforts meaningful, that is vaccination. A word of concern, at least in our country, is the possible role of schools. You see here, in late September, there was the beginning of the opening of schools. And if you look at the situation in the north of Portugal, you see that it went up and down with schools closed. Schools open. It went down and up with schools closed. And then there is this huge wave in around January, that early in January, beginning after Christmas, that was common to many different countries. And again, it's difficult to understand this, but you see here this gray area represents the time we have been under very strict restrictive measures. And as you know now, if you look, it's my final image. If you look at this stringency index, Portugal is really up here. Ireland is even more restrictive now. But you see the differences, for instance, comparing to Spain, our neighboring country. And this brings us to the last point. I completely agree that we need a huge effort of testing, tracing, isolation. We need to use digital tracing. The medical doctors, public health professionals were really not happy with using and promoting our Stay Away COVID. It's the name of our contact tracing app. Was a pity, because we had more than 2/3 of the population, the possible population, downloading the app, and the services were were unable to give people what they were asking for, a code to make possible the information being sent away from somebody infected to possible contacts. And finally, border control. And that's why I'm bringing here Spain, because, you know, we have a huge internal border. This border is difficult to control. Many cases, many outbreaks were clearly related with places where we have airports and where we have large border connections with Spain. We have a really nowadays we close the flights with the different countries like Brazil, for instance. Boats cannot passengers from boats cannot enter the country except if they are nationals, but we still lack a clear policy when the borders will be finally open. So there is still discussion about green certificates or passports, whatever you want. So we are so low now in the country. In terms of a number of cases, we have less than 50 cases per 100,000 per 14 days. So I think we can clearly embrace an elimination strategy, but we need to put in place these essential tools, border controls, digital apps, and an effective isolation, testing, and tracing policy. Thank you.
Thank you very much, Henrique. It's very interesting to hear that, and I hope Portugal does manage to get to the final step and eliminate this devastating disease. And it's interesting also to see that the steps that are needed are the same everywhere. So we really do learn off each other. So our final speaker before we move to the questions and answer session is Fidelia Cascini. She's an adjunct professor at the Department of Public Health in the Università Cattolica del Sacro Cuore in Rome. And she's a member of the Task Force Data Coordination Unit established by the Italian Prime Minister's Office for the COVID-19 emergency, and the leader of the COVID-19 working group of the World Federation of Public Health Associations. It's lovely to have you here today, Fidelia. It's great to have your contribution.
Thanks a lot, Professor McLysaght, for inviting me and for the introduction. I prefer to explain the Italian situation and criticism about the accomplishment of the COVID-19 elimination strategy, answering the questions you are interested in. The first question is, what have been the main factors preventing a national COVID elimination strategy to date? Well, we have noticed that the first barrier to achieve an effective COVID elimination strategy in Italy has been the acceptance of people about restrictive measures and limitations. And this is true, especially when restrictions have been required for a long period of time. Further, there are different levels of risk perceptions in the Italian population. For instance, most of young people think that they are not at risk of serious health outcomes. And this feeling doesn't help to reach the goal of COVID-19 elimination, for sure. About the interplay between strategic decision-making at local, national, and European level, and how that affect prospects for a COVID elimination goal to be reached, I can say that in Italy, the decision-making process concerning strategies to face the pandemic is centralized. Local authorities have to follow what the Prime Minister decrees establish according to evidence and evaluations collected by the Scientific Technical Committee of the Ministry of Health. The central government also takes care about the strict cooperation with the EU member states to reach shared decisions to control the pandemic, as it is these days about the Green Pass certificate. Then this centralized model is good to drive our country towards quick and shared solutions to manage the public health emergency. However, the weakness in reaching the COVID elimination goal depends on the different positions of the political parties about the most restrictive measures as the national lockdown. Then you are also asked me what are the prospects for a policy of managed quarantine for all international arrivals into the country, EU and non-EU. The Italian authorities have adopted regulations including mandatory testing requirements, quarantine duty, temporary ban on entry for both European and non-European countries. For instance, travelers who have been in Norway and Iceland during the 14 days before to arrive in Italy must take a molecular PCR or rapid antigen test to verify the negative result. There's no need of isolation, but travelers must notify the local health authority about their entry. Another case is the entry of travelers from Brazil, which is restrictive now, allowing the return just for people who are Italian residents. These people are tested before departure and after their arrival. Alternatively, they have to observe a 14-day isolation with an additional final PCR test. Testing and isolation have been also introduced for travelers coming from Austria, where the South African variant is circulating. Then what have been the difficulties in achieving the necessary level of testing, contact tracing, and isolation to manage case resurgence? In Italy, we didn't find it difficult to reach the necessary level of testing, except for the beginning of the pandemic, when our national health system had to adapt its capacity to the emergency situation. However, we found lots of difficulties about the acceptance of contact tracing app. It is named Immuni in Italy because it wasn't appropriately, the difficulties depends on the fact that it wasn't appropriately and timely supported by a nudging campaign to persuade people to use it, overcoming skepticism and doubts about privacy protection. And other aspects is the vaccination strategy and its role in COVID elimination. A good vaccination strategy is crucial to gain trust of people and allow the return to a normal life, protecting mainly fragile and elderly people. However, it can be the solution for COVID elimination. I think it is one of the most important tools we have to limit the efforts required to practice the elimination strategy. So, when and how should society reopen? You asked me, and the question is that I think society should open when vaccination campaign is advanced enough to protect fragile people as elderly people and people with disabilities or illnesses different from COVID-19 also. Finally, what should be done at a European level to facilitate COVID elimination? We think that a strict cooperation among European countries is the most important thing we can create to eliminate the pandemic and protect ourselves. This is the direction we are currently going to, and the preparation of the Green Pass certificate is a concrete example of this intention. We have to proceed like this because if the virus is the same, it doesn't make sense that the countries' answers are different. So this is my opinion and for sure the situation from Italy. Thanks a lot.
Thank you very much, Fidelia, and to all of our four speakers. It's been really interesting to hear everybody's perspectives from different European countries, and actually, you know, seeing how similar it is actually across Europe, and it really is an opportunity for I think a shared approach as well. So we are ready to take questions now. There was a question about the Irish data, which I might just do quickly first, and I also encourage different members of the panel, the members of ISAG as well, to please contribute conversation. I think it'll be interesting to have a conversation here. But James, perhaps you could answer this question. This person was asking if the population density is playing a role in places like Cork and Kerry, or if there's some other explanation there.
Thanks, Aoife, and thanks to the questioner. Well, the first observation is, yes, there's quite a rural, they're quite rural counties, but also Cork is the third largest city in the island, second largest city in the Republic. So it's a dense population, Cork City, and so I don't, population density alone isn't the story. Now, local factors on the ground, maybe some of our Cork colleagues could speak to, and clearly there's always luck here. There's random seeding, there's different travel patterns, but there's also, so I'll be interested to hear what our Cork Kerry colleagues say on the call.
Sorry, I was muted. Everybody's interested in what Cork and Kerry are doing right. And I see there's another question along those lines. But I think the important thing is that, it shows that we can suppress B117. It's not something where we need to give up, because yes, it is more difficult, but it isn't a lost cause. And there's still a lot that we can gain in this situation. So Cecile, you mentioned, and Antoine as well, you mentioned New Caledonia. I confess I don't know anything about New Caledonia. Maybe Cecile first, could you tell us something? Was this an easy win because it's an island, or did they have to take steps there?
I'm not an expert of the New Caledonia situation. What I know is that actually, maybe what helped immediately is that they had no healthcare infrastructure. So from the beginning, they knew that they could not count on it. So they immediately saw that they had to eliminate the virus. But then, and that's another interesting thing, is that they imported it through doctors coming from France. Okay. And that were not properly tested and did not respect the isolation process. So then they had to get rid of those clusters that had developed, and they were successful in doing it. So I guess being an island, of course, is harmful. It happened that not counting on health infrastructure is also, it pointed out to the elimination strategy, which in this case is a winner. And so that's what I know. I've not been looking into more details, but it seems maybe Antoine is going to. We'll be able to say what are the numbers there. But I would say those two main points have been important.
Thanks, Cecile. Antoine?
Yes, no, I completely concur with what Cecile said. And New Caledonia is in Pacific Island, and it's a very remote area, and it has a deep autonomy. It's not like Guadeloupe or Martinique or even Guyane, which are French department, or Réunion Island. It's more like Tahiti, which has an autonomy. So they have decided themselves to protect as a zero COVID strategy. And of course, it's an island, again, like New Zealand, I would say. And so it's easier to protect. And what the lesson we can learn from that is that protection of borders, like Henrique said, is quite important to assure a zero COVID, or even an aggressive suppression strategy.
That's a perfect lead on, Antoine. It's almost like we rehearsed this, because I wanted to ask Henrique about how in Portugal you are managing your border with Spain. I guess it's a complex border, like many are, and you have a hard-earned strategy now that you have, earned this low case number. And how do you manage this with your border?
Well, to make it easier, we can say that essentially borders are closed. It's very difficult because, we have problems like in other European countries, with people living in one side of the border and working in the other side. So that there was a need to guarantee that these type of situations could be solved. And we have a lot of families that part of the family lives in Spain and part of the family lives in Portugal. So and there is some tension, you know, people feels that their rights and are being to a certain ways very much. I mean, they have concerns with their civil rights, but it's for time being, you know, it's the pandemic, because Portugal, as you have seen in my graph, we were in a wonderful situation in the beginning. Then we went through a terrible situation, and now we are we are clearly one of the countries with the best situation in Europe. So, I mean, understanding this, what's happening, why, the major question. But going to, if you allow me, the islands, as we have them with a certain degree of autonomy. For instance, Madeira Islands, where the pandemic has a completely different situation from Portugal. In Portugal, it began in the north, people coming from a textile fair in Milan. But in Madeira, which is a very touristic place, the first case was a tourist from the Netherlands, and they clearly understood that they could control the situation, and even the case fatality rate is half compared to the best rate in continental Portugal, and they have not the best health service in the country, but you know the burden of disease was so low that they could continue to put all the efforts and guarantee a good response. So it's very interesting to look at in Madeira, not only the number of cases, the incidence is very low, but even the case fatality rate is half compared to for instance, to the north of Portugal.
And Henrique, just one, has the idea of border bubbles with Spain been discussed at all? It's something that was successfully implemented, I know, in Australia.
Not officially,
okay,
but among mayors in border towns, that's something they have been discussing, and also to make common efforts to guarantee vaccination of more vulnerable people, and to put more emphasis on the need to test and trace. But officially, I mean, between both governments, let's say central governments, there is not yet a clear policy about it.
Thank you, Henrique. So I know Yanir would like to bring up a point now as well. So Yanir.
Yeah, thank you. So one of the things that happens is that people often don't have visibility into what's happening in different countries because they take for granted what's going on in theirs and not compare it with others in detail. So for example, in Portugal, there is, as I understand it, Henrique can correct me if I'm wrong, there is restriction of travel between municipalities going on now. So that people are actually not allowed to go from municipality to municipality. And that actually is a critical aspect of the fact that Portugal is being so successful in controlling the dynamics of the outbreak. And this is indeed, you know, when we talk about the border control, people do think that as is Portugal doing now, that the border is basically closed to Spain. So there's an opportunity to do this. But we know that it is possible to create border bubbles and to have commuters go across borders with appropriate permits and guidelines so that it doesn't affect the ability to do it, so to achieve elimination. So I actually want to show for a moment, let me see if I can share my screen here. This is the current situation of Portugal. Now, the green areas that are really have control of the outbreak at this point, obviously is a major part of the area of Portugal, though it is in fact not the major urban centers, which are here and here, as I understand it. I don't have the details here, but the point is that the really opportunity is to start opening up to normal the areas that are already at zero, and then to contract the areas that continue to have the disease. And again, the travel restrictions are already in place. So one can achieve it very directly just by following that process. And I want to just remind, because it's a little bit easier to see how this works in the context of what we call a fire plot, right? So this was the contraction, the original contraction. Along here are provinces of China. And what we see is that after they locked down, within a few weeks, there was a tremendous contraction of the area. And then by here, almost all of the cases are isolated. And this is the dynamics of an elimination strategy where you go all out and within a few weeks you achieve elimination. But it's super important to see how it occurs geographically. And when we look in Europe, so this one is for Ireland. And what we see is, again, we see this dramatic contraction. But notice that if you don't focus attention on the geographic contraction, then you continue to have just a few cases because you didn't try to achieve the elimination that was obviously in hand. By now, of course, here, there could have been elimination entirely. In fact, we know that Ireland achieved elimination in the summer were it not re-importing of cases from outside travel. And if we look here at the situation in Switzerland as an example, we again see this dramatic contraction. And only later, when the relaxation of restrictions happened, of course, this is when cases became growing again rather than achieving elimination. Now, here is the beginning of Italy. And for whatever reason, and we were watching this at the time, and it was very distressing because Italy had an incredibly long time for the outbreak control. And this is on the left here, this one is Italy. And this is 4 months, right? So up here we have March, early March. It was the beginning of the, or mid-March was the beginning of the lockdown. But notice that you go to June and you have the geographical contraction. So in fact, a major part of Italy, particularly of course, southern Italy, was COVID-free, but it wasn't stopped at that point from reinfecting the area. But the northern part of Italy, Lombardia, never actually got down. And the reason somehow had to do with the specifics of the restrictions that were adopted. So it takes these two things that have to be hand in hand. One is the awareness of the opportunity for geographical contraction, and the other is the making sure that the cases are going down rapidly enough so that people don't lose patience and decide that they have to open up. This, by the way, is Argentina, that had tremendous geographical limitation from the beginning, but they had a very hard time in Buenos Aires, the core city. Now, we know also how to do that. We know from even terrible slums, right? The world biggest slums in Asia, in India, in Dharavi, it is possible to achieve elimination even in terrible slums, but it takes a concerted public health engagement. And the point is that if you contract the area that you are fighting, then you can put all of your efforts into the elimination in those difficult areas. This, by the way, is Russia, that allowed cases to propagate all across the country. So the issue of geographical contraction is central to achieving the elimination.
Thank you, Yanir. And that's the opportunity we missed last summer that Antoine was mentioning. There's a question from the audience been asked by multiple people regarding school closures and reopening again. And this is relevant, I think, for Ireland, but also for countries across Europe. So I'd be interested to know from any of the panelists their views on the impact of schools and school closing and reopening. So maybe whoever wants to speak first might just jump in or wave their hand. Don't all jump at once. So It's Gabriel, please. Thank you.
Yes, the England took the unusual decision to reopen all schools all at once. So that happened a week or two ago. But it's very difficult to discern what is going on because we have had an enormous amount of vaccination and we haven't yet seen any major increase in cases amongst young people, though the decline in cases is tailing off and flattening out. I think what is most disturbing about the opening of schools issue is that, and this is very much the view of Independence Age in the UK, that we're not opening the schools safely. So we have not seen a programme of works to ensure ventilation is improved in all places. We have not seen a programme of works taking over extra space so that children and young people can be properly spaced. And we have not seen the provision of free masks and the wearing of masks across the school system. Neither have we seen teachers given any priority yet in the vaccination programme. So schools are open across the UK, but not under circumstances that I think anyone from a public health perspective would think was satisfactory.
Thank you, Gabriel. Antoine.
Yes, just to mention that school closure is a vivid debate everywhere in the world, and it's of course quite understandable. Education is a human right, is a children's right. You cannot compensate the loss of education in children as you can compensate maybe the loss of income for owners of restaurants and bars. So it's something which is very, very tough and difficult. But the point is, I think, as Gabriel said, because of this debate, there was some deny about the risk in school, which is high. It is particularly high because all the adult life has been mostly locked down all over the Western world, I would say, during these major outbreaks we had to face from now a couple of months, I would say, at least from October. And life has been closed in home office, bars and restaurants are closed in many parts of Europe. Cultural life, sport life has been reduced at the minimum. So the interactions between adults are very, very low, and the only remaining interactions are at school age. Schools are very, very dangerous in terms of circulation of the virus. Of course, not in terms of health outcomes for children themselves, which add a layer of complexity because you are not motivated to close schools when you don't have health risk for children, or at least major health risk for children. So just to say that I am very sensitive to what Gabriel said, that securing schools by ventilations, by testing, by particularly by promoting outdoor activities have been neglected and should be reinforced, because of course school will open anyway, at least in September everywhere, and it may not be completely safe. And in addition to that, we don't have vaccines for school-age children. So it is highly important. First of all, I think France, probably Germany and Sweden are at the eve of closing their schools again for a couple of weeks in the coming weeks. I don't know what Cecile foresee regarding France about that, but so they will close. We will hopefully go to a better epidemiological situation in the coming weeks, in maybe next month or two. And after, we will have to reopen again, and we can reopen, but with a very, very secure manner.
Thank you, Antoine. Yes, it'd be interesting to see if schools would use their their playing fields, their sports areas, when they can, especially as the weather is improving, that's more plausible. Cecile, did you want to add anything on the situation in France with regard to schools? They've stayed open so far.
Yeah, they stayed open so far. And I actually, as a mother of 2 young children, I've not been, I do not agree with what we are doing right now concerning schools, because actually they are not safe. And I'm very concerned about long COVID with kids. We know today that they can get sick or get to have like a long COVID symptoms, and they are young. So my feeling right now is like, because we are not able to make them sure, we still send them because it is convenient for parents, but also, and it is a complex issue, because that's something I could not believe at first, that actually we could not think about closing school, and that we were proud. I mean, France believe that it's the product, I mean, the greatest things we've done in the last, I don't know, in the last year, that we have been able to let schools to have schools open. But first, they are not safe. Then we completely ignore long COVID and transmission. And actually, the one thing that we are completely failing at is distance learning. And I've started to believe that it is one of the main reasons why we are not able to close, at least for a few weeks, school, so that we limit transmission, is because our public education system, even though we've been 12 months into this crisis, they are still not able to implement a simple system of distance learning, and at least offering parents who are able to do it for their kids, at least to have them at home, so that for all the kids that would need the extra care or need to go to school, at least we can focus help on them instead of letting this happening. And as Antoine said, I mean, as parents and as adults, I mean, our lives are really like completely locked down, like for months. So it's so yeah, I'm quite angry about this.
It's a hugely emotive issue, because as everyone knows, and everyone has already mentioned, the education of children is so important, and you can't put it on pause the way you put other things on pause. And yet we can't also dismiss the risks to their own health, and then the risk to prolonging the pandemic. It's interesting what you said there, because in Canada, I know at least in certain states in Canada, they have what they're calling a blended approach, which is they're giving parents the choice. You can keep your child at home and allow them to do distance learning. So they'll provide an online learning platform, or you can send them to school. And because of that choice, automatically the school population becomes much smaller. So that it automatically becomes safer by the fact of being less dense in terms of the population. There are questions about Ireland, and I know our visitors can't answer these, but I'll just quickly put them to the panel, because people are very interested in Cork and Kerry, and we have Jerry who's here, who's from the area, and there's also a question that's relating to that's a related question, which is to do with whether the HSE is doing any extra hunting down of chasing cases other than the new pop-up clinics. And maybe Anthony might be able to answer that question. But maybe Jerry, would you be able to pop in and tell us a bit more about Cork and Kerry and what we can learn from there?
Yeah, it's just an observation. It's Cork, Kerry and Kilkenny also are parts of Ireland where we've had a chance to talk about the issues on public radio, and where public radio and local communities have had a chance to speak about issues and see, and to listen to them, to the merits of elimination strategies that, don't make it so easily onto national media. So everything's local in this game. And I think all of us on the panel here have had plenty of invites from Cork and Kilkenny in particular. And that just goes to show you what a big difference local action can make.
Thanks, Jerry. And it harkens back to the green zone strategy and that as well, you know, we have these regional gains and we could be protecting them and increasing those green zones as we progress through. Anthony, could you maybe address the question about what the HSE is doing to like actively chase cases rather than waiting for people to present to them?
They're not doing a lot. We have the walk-in clinics, which are getting about 2% or 3% of the people testing them are positive. There is no widespread availability of those clinics. They're available in areas where case rates are relatively high. There is a plan to move them around. We're starting 7-day retrospective tracing, I think this week or perhaps next week, which we should have been doing for the last 11 months, but you know, better late than never. We're only going back 7 days, which we know is not long enough. I mean, that's not in discussion. We know it's too short. And it's still unclear who is going to do it and where the bodies are that are going to do it. The tracking and tracing system is not really working and is not being delegated appropriately to regional public health who could make it work. So we're moving very slowly in the right direction. But a year into a pandemic, it's hard to argue that we have acted quickly enough. We have done better than some other European countries, as our colleagues have articulated. So our response to COVID-19 has been by no means a disaster, but it's been very much built on the back of continuing restrictions and continuing lockdowns. And many of us would argue that was not necessary, that we could have done quite a lot more with more effective public health. And I'm not sure that message has sunk in yet at central government level.
Thank you, Anthony. So Cecile, I think we're going to finish with just a question to you and then we'll wrap up, because I think you bring a different angle, which is the perspective of the economist. And just wondering if you would have any views on what the role of economists is, or what it could be in convincing the politicians about the optimal strategy.
Yes, I was answering it through the discussion. Okay, you know, from the beginning, I've been fighting with my team, you know, with all the economists I'm working with, telling them that as economists, we had a duty to think about the economic means to fight a pandemic. And the answer was like, yes, but we are not epidemiologists, or we are not doctors, or so there were no interest, you know, but thinking about what are the economic means to fight a pandemic. And actually, so, and even among health economists, which in France are not that many, or they are not that many, but the good news is that in the last few months, we had some really well-known economists in France that have really taken the view that the stop-and-go strategy was enormously costly, and that we really need to embrace the elimination strategy, because actually it is better for the economic. So it is slightly changing, and you know, there we can feel that there is something building up, you know, with time going on, but it's slow, it takes time, but at least there are those few names, and they are not weirdos, you know, like they are big economy. I mean, they are really renowned and well-known economists. So I'm hopeful that, you know, it's going to get the interest of economists. But Hélène, you're right. I mean, that was one of your questions. We have not paid attention enough to this issue, and you know, we are always thinking about the world after, you know, that's something that was amazing. You know, all the economists were speaking about the world after the pandemic, not knowing how we were going to solve it. So yes, it would be great to have more economists working on this issue.
Thank you, Cecile. So I think maybe Henrique would like to just say something on the school strategy in Portugal, which I think would be very interesting to hear.
Oh, sorry, I know we are running.
No. It's we have you here for one day only. We're very interested to hear what you have to say.
Yeah, but I think it's interesting because, you know, we look at what happened to children and adolescents in Portugal and in many countries. They almost lost 2 crucial years of their lives, and the major question is, in a country where health inequalities and social inequalities are so high as in our country, it's clearly, and even from studies based on studies done by a group of economists in Portugal, that this full range of inequalities are more profound now than they were 1 and something years ago. So we think that schools should be a very protected bubble, and we cannot use schools to guarantee that parents stay at home, which happens very often, you know. But I think if Portugal has done something very well, was the way the schools responded. There is almost no cases in schools or outbreaks, even in universities. For instance, here in Porto, we follow every case, and you are unable to document a transmission in the premises of the university. We last week vaccinated 80,000 teachers and administrative and the personnel in school. So we covered most of the people involved now, because we had this policy of opening not every school. So we began by nurseries and primary schools, and hopefully by the second week of April, there will secondary schools open, and then universities. But we think this it's very relevant to guarantee the conditions in terms of vaccination, testing, protective measures in schools. And I think the schools in Portugal have done it very well.
Thank you, Henrique. And I think this is a good note to finish on. We're almost an hour and a quarter. I think that's a good amount of time. So it just remains for me to thank everybody. I'd like to give a special thanks to Helen Doak from the University of Ulster, who organized today's webinar and invited this excellent panel of speakers. And thanks to our speakers, Dr. Cecile Philippe, Professor Antoine Flahault, and Henrique Barros and Fidelia Cascini. So I think some very interesting perspectives from around Europe, and a very consistent message really that we're dealing with the same problem across the world, and we can learn from each other in how to do this. And I think we see across the world that the same things are needed. It's a matter of dedication to the task. And so thank you again to everybody for participating. Thank you to the audience, both in the Zoom room, but also through Twitter and Facebook, and anybody who catches up later as well. So thank you, and see you next time.